I'm often asked whether TENS can be useful for plantar fasciitis. So let's have a look at what the research shows. Does it actually help it? So we'll look at whether it can help pain, and we'll look at whether it actually helps healing. We'll look at what the best placement is for the pads and what settings you want to be using it on. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries, all done via video call. Have a look at the description of this video if you want a link to our website. The two ways in which TENS may help plantar fasciitis is either through decreasing pain or improving healing. Now, if we look at pain first, there's actually a lot of research out there, both on acute pain that you've had for a few weeks, plus chronic pain that you've had for months and months and months, that TENS could be useful. However, it only seems to work for in-the-moment pain. So what that means is that it works while you've got the machine on you, but then when you remove the machine, it may help for a short while after, so like an hour or two, but it doesn't have a lasting effect. So in practice, this means that if you have a really, really painful case of plantar fasciitis, TENS is definitely something I would use to help you decrease that pain, especially if you don't find medication effective. But it's not going to be enough to get rid of your pain. You have to do it the other things that we know helps for plantar fasciitis, and we've made other videos about that. Have a look at the description of this video if you want to know what the other types of treatments are that you could use for plantar fasciitis. With regards to healing, there's not a lot of research out there actually. The only studies I could find was either looking at wound healing or at tendon healing. Now, this could be useful for plantar fasciitis because both skin as well as tendons are made up of collagen, and collagen is one of the main building blocks of plantar fasciitis, or the plantar fascia as well. Now, what the research shows is for wound healing, maybe it can help it, but the problem is there's only a couple of studies out there and they're quite small studies and they're not the best quality. So we can't 100% trust the results there. We need larger studies to show the same thing. As for tendons, there's only 3 studies that I could find, and again, the same thing. They're not the best quality studies. 2 of them shows that the TENS can actually help tendon healing, and then one of them shows that no, actually it had the opposite effect. It inhibited tendon healing. So again, we're not quite sure. Now, from experience, I've never seen that my patients who use TENS on a regular basis have any worse recovery than others. Also haven't seen them recover at a much quicker rate. So I don't personally think it influences healing, but I have seen some patients really benefit from it because it decreased their pain. And if that means that you can get on with your rehab and the things that we know helps for plantar fasciitis, then it's definitely a useful thing to use. Okay, so how do you actually use it? Where do you place the pads? Well, the research shows that it doesn't really matter. What matters is that the current has to cross the painful area. So typically with plantar fasciitis, the main pain is quite close to the heel. So if this is your painful area, you want to either place it on the sides of it, so one there, that the current crosses that, or you can place it top and bottom, that it crosses that way. It doesn't matter. Now, if you look at different sizes of pads, if you've got a small foot, I would go for the smaller ones because it's going to stick better, but you get packets with lots of different sizes in them. I'll put a link in the description of this video to different products on Amazon that you can just go have a look and see, because usually those pads fit on different types of machines, so they may fit on the machine you've got already. Then as to the intensity of the current, again, the research has shown that it doesn't really matter. What seems to work best is if they have it as high as the person can tolerate, but without it being painful. So it's got to be a strong signal, but not painful signal, because if you create pain, that actually amplifies pain in the end. So you want to have it strong, but not painful. And you don't want to have any muscle contraction. So if you find the muscles in your foot starts contracting when you have it on, you've got to decrease it because then the current is too strong. The only thing with TENS is that you get used to it. It's kind of like white noise. You know how you notice a sound at the beginning, but if it's there for long enough, you actually don't notice it in the end? Well, the same happens with the sensation from the TENS. So it's best to use a current that modulates, that has different things, that sometimes it goes short, sometimes it has longer breaks between the stimulus. So play with it and see what setting on your machine works best for you, that you don't get used to the signal while you're using it. And lastly, there doesn't seem to be a time restriction. It seems to be safe to use it for as much as you like, as long as you like. The only problem comes in that the pads may irritate your skin or cause a rash if you use it too much. So take care with that. The only serious side effect that TENS can cause is that it might interfere with electrical currents from other devices you have. So if you've got a pacemaker, for instance, you don't want to be using the TENS over the pacemaker because that could have an effect on it. But I mean, if you're using it on your foot, that's very far from a pacemaker, so that should be safe again. But look at the instruction manual of the manufacturers. They're usually very good at stipulating all of the contraindications for it. Brilliant. Hope you found that useful. Now remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.